Good afternoon, everybody. I'll hand over to the Director General so that he can run us through today's numbers, and then I've got a bit of an update on schooling in the lead up to Christmas and next year, and then we'll take your questions. Dr. Bloomfield.
Thank you, Minister. Kia ora koutou katoa. So today there are 147 new cases in the community. Of these, 131 are in Auckland, 14 in Waikato, and 2 are in Northland. We've also got 2 cases in returnees in managed isolation. There are further details and breakdown in our 1 p.m. statement from the Ministry of Health. Sadly reporting a sudden death of a man in his 60s who had COVID-19 overnight. He was isolating at home in Glen Eden in Auckland. Now the cause of death will be looked into by the coroner, including whether it was COVID related. Any deaths that could be COVID-19 related are fully investigated, whether they occur at home or in the hospital setting. Obviously, our thoughts are very much with this man's family and friends at what will be a stressful time. In terms of hospitalisations, we have 81 people in hospital with COVID-19, 11 are in ICU or a high dependency unit, and they're all in the Auckland region. Good to see testing continues a really good volume, particularly in Auckland, and yesterday just under 28,000 tests processed around the country and 3,423 swabs taken and processed in Auckland alone. Further on Auckland, our team up there has identified 6 suburbs of concern because there is a higher risk of there being unidentified cases and transmission there, and so anyone in the suburbs of Ranui, Sunnyvale, Kelston, Birkdale, Manurewa and Mangere are encouraged, if you have any symptoms at all, whether you are vaccinated or not, please go and get a test and stay home until you receive a negative result. Moving down to the Waikato, as I said, 14 new cases there. Of these, 10 are in Otorohanga. That includes 6 in one household who were known contacts. 3 of today's cases there are from Hamilton and 1 in Ngarawahia. Some of those cases are as yet unlinked, but interviews are underway at the moment. There is testing widely available through Hamilton and across the Waikato again today. And there was 1 location of interest identified yesterday, and that is the base in Hamilton, so please check the Ministry website to look at the time and date where that exposure event was and look at the instructions there. Up to Northland, the 2 cases to report, both in the same household in Dargaville, and there are probable links already known to cases in Auckland that have been identified there. One of those cases is a child under 1, and this highlights that COVID can affect anyone of any age, and all the more reason for us to think seriously about vaccination because it's one of the best ways to protect our tamariki. Good testing capacity across Auckland again today, and really good to see vaccinations continue to go well in the Northland area. Encourage anyone who hasn't been vaccinated yet to get along and do so today. Just coming back to COVID-related deaths and clarifying our reporting of these, we're going to be changing the way we're publicly reporting deaths associated with COVID-19 to make sure the data are provided in a timely way and also to indicate where there may be other causes of death potentially. So the clinical criteria will continue to be guided by the WHO definition, which is basically to report any death where the person had an acute COVID-19 infection, regardless of what the cause of death might be. We will be now publicly reporting confirmed deaths as those where the death documents or an investigation has shown that the cause was COVID-19, and we will report other deaths where the cause of death is not certain, but the person had COVID-19. We will report them separately. And the latter group will be classified as under investigation while we await further information from the clinicians or indeed a coroner's follow-up investigation. Just an update on our modelling. Last Monday, 1st of November, I showed some modelling from Dr. Gary Jackson, one of the team up in Auckland, regarding forecast case numbers, hospitalisations and ICU numbers, as well as the R value. And that modelling had forecast around 200 cases per day by the end of this month in Auckland, around 1,400 cases a week, based on median numbers. And if we look back at cases last week, as I mentioned on Monday, they were virtually spot on with what the model had forecast in terms of case numbers. Hospitalisations were somewhat higher, but ICU numbers a bit lower. And just to show that by the end of November, to reiterate, the modelling predicts each week around 150 new hospitalisations and around 11 ICU admissions. But I do want to put that in context. There are more than 1,700 hospital beds across Auckland and over 100 ICU beds. ICU bed capacity does change on a daily basis depending on what the local needs might be, planning and staffing, and so those numbers can be increased both in Auckland and around the country. It's important to know the hospitals in Auckland will have and do have capacity, so anyone who needs care for any reason, do not delay in seeking it. The hospitals are safe. However, we do want to limit the impact of COVID on our hospital system and indeed our wider health system. Two things people can do there are to be vaccinated and secondly, to abide by COVID-19 restrictions. And most importantly, if you are unwell, don't go out. Two vaccine updates. First around an update on our portfolio. As you know, we have the 4 vaccines in our portfolio, 3 of which have had provisional approval from MedSafe. To date, our program has focused on the rollout of the Pfizer vaccine with a high level of success to date and ongoing progress. That will continue to be the primary vaccine available in New Zealand. However, we know there is a small number of people in New Zealand who cannot have the Pfizer vaccine, and so we think it is appropriate to have an option available for them. So those are people who cannot have Pfizer for medical reasons, and that's likely to be just a few hundred people. There are other people who may have a different reason for wanting another option, and that includes people who are required under an order to be vaccinated to be able to continue in their work. We are requiring them to be vaccinated to protect themselves and the people they work with, which might be patients in a hospital setting or, of course, children in school settings. So on the basis of advice from our technical advisory group and some work from our vaccines team, we are in a position to be able to make AstraZeneca COVID-19 vaccine available as a second option for people aged 18 and over. And like the Pfizer vaccine, this will be a 2-dose course. We'll have more details about this next week, including the timing. The availability is likely to be in late November. But there is quite a lot of work to ensure that the workforce is trained to administer a second vaccine, that clinics are available to do so, obviously cold storage and logistics are in place for that. So there's some work to do there, but I'm just signalling that that's an option that will be available. Not for everybody. Again, those 2 groups, those who cannot have a Pfizer vaccine and those who are required to be vaccinated but are not prepared to have an mRNA vaccine but may be willing to have the AstraZeneca vaccine. It won't be available as widely as the Pfizer vaccine, and I do want to reiterate that Pfizer remains, for good reasons and based on scientific advice, the mainstay of our vaccination program. And continuing with Pfizer, as you will know, on Monday, MedSafe approved a 3rd booster dose of the Pfizer vaccine for people aged 18 and over who've already had the full 2-dose course, and recommended that that be for a minimum of 6 months since their 2nd dose. I've now received advice from the COVID vaccination technical advisory group with some recommendations on priorities for boosters and how that should be rolled out, and we'll be providing advice through to our group of vaccine ministers on Friday. But again, we are getting closer to being able to roll out that booster program, starting with those who were vaccinated first and who are at the highest risk, which is our healthcare staff and our people 65 and over, and those who were vaccinated early. Further details next week, once ministers have made a final decision. But again, we're anticipating late November as the timing when that program will get underway. And just to reiterate that this is separate from the 3rd primary dose that has already been available for people with severe immunocompromise and has been rolled out already successfully. Thank you, Minister.
Thank you, Dr. Bloomfield. We're now in a phase where we're looking to ease restrictions and reopen to the rest of the world. But we think it's absolutely vital that we do that carefully and safely. And looking forward, both towards the end of this year and into next year, we do want to ensure that we're providing as much certainty as possible for students, teachers, their whānau and their communities. Nobody wants to be in a situation heading into the summer break or ahead of term 1 next year where we're still unsure around how children and young people can return to school, kura, and early learning safely. Today I'm outlining a plan to return to face-to-face learning this year. That will look slightly different to what we're used to. We'll all need to become comfortable with the idea, and we'll all need to get used to public health measures that will now be in place. For years 9 and 10, they'll return to school, joining those students where there are already year 11 and to 13 students back, preparing for their exams. That can happen from the 17th of November. For children and young people in years 1 to 8, students will also be able to return from that date part-time. That can include alternating days or half days through year levels or through whānau groupings. Full-time learning will continue on site for the students whose parents have needed it. For example, when they're going to work, those students are already back full-time now. Each school or kura will get a bit of flexibility to decide what works best for their learners and for their community, and they'll have full support from the Ministry of Education's regional directors. Schools will be in touch with their communities directly about how they are going to be structuring the return to school and what that means for their communities. Public health advice supports a return to on-site learning. Some further measures do need to be put in place, and they will be. That includes mask wearing for year 4 and up, ventilating classrooms, which will become a lot easier over the summer break, limiting the number of students on site, and making sure that groups of children distance from each other. The health advice also tells us that in other countries, out-of-school activities actually create a greater risk of transmission than what happens in a place of learning. So what's clear is that the risks of reopening schools are outweighed by the benefits of kids re-engaging in their learning in a face-to-face context. The balance of risk is shifting as we continue to see vaccination rates throughout the community increasing. Auckland is already at more than 90% first doses, and that does provide a good layer of protection. When schools go back next week, all teachers on site will have had to have at least 1 dose of the vaccine, and that further helps to reduce the risk of transmission. The ongoing restrictions have been incredibly hard on children and young people, and of course their families as well. And returning to school, interacting with their friends and their teachers, and getting back to face-to-face learning will have a positive impact on their well-being as well as their learning as they head towards the Christmas break. We also know that COVID-19 has been pretty tough on the staff working in our schools, our kura and our early learning services. And we know that they'll need a bit of time to build back from that disruption and have a bit of time to focus on their own professional development as they and their students to make sure that they've got the best chance of success. So the government's decided to ease the requirements on schools for the National Curriculum and Assessment Program changes that we are making to ensure that they've got time and space to manage the return to school following the disruptions caused by COVID-19. So that means resetting the timelines for the refresh of the curriculum, the introduction of New Zealand history, and the NCEA change program. For early learning services, it means delaying the consultation on gazetting of the early childhood curriculum Te Whariki. These changes, these programs are still critical, and they're still very important parts of the government's work in the education space. But they do require considerable effort, and we acknowledge that between now and the end of the year, we need our schools and our teachers and our early learning services focused on supporting a return to learning. So I believe that time spent reconnecting with communities, focusing on well-being, and of course teaching and learning, will serve our communities best over the next few months, and that's what they should be focused on. So happy to open up for questions. Jessica.
Why did you decide to make it part-time for primary school kids to go back? How did you land on that? There's only a month left of the school year.
So we're looking at public health advice. And you'll note that, yes, it will be part-time for most students, and schools will manage that in different ways. We haven't set a hard and fast number because, of course, it'll depend on the school. It'll depend on calculations like how much space do they have, how much of their learning can they do outdoors. So they'll be following public health guidance around just managing that transition back to school in a way that works for their community, while also providing that reassurance, that layer of reassurance to parents. I'm very aware that there are some parents out there who are going to be really nervous about sending their kids back to school, and so we want to support them through that process so that they can have the confidence to do that.
On the flip side, though, there'll be some parents sitting at home weeping at that announcement that it'll be part-time. As a parent, can you understand how it's tough for them too?
Oh, no question at all. Look, I've spent several months at home with my own children over the last couple of years with the COVID-19 response, and it is pretty tough going. And that is a fraction of what the parents in Auckland have had to do over the last few months. So I absolutely acknowledge that.
Why do you think it's safe now for year 9s and 10s to go back to school in high school environments?
Ultimately, remember, this is a cohort who can be vaccinated, and we have seen good vaccination rates. So we're looking at 80+% first doses for that age cohort already. And so that gives us that extra layer of confidence in allowing them to go back in greater numbers than in primary schools where vaccination isn't currently an option.
Bloomfield, the man who died at home, did he have a pulse oximeter, and when was the last time health officials spoke with that person, if at all?
I don't have any of that information just at the moment, but that's information. The death was only notified this morning, and we will be looking and seeing just exactly what contact he had and what support was in place.
That should be something that you'd have pretty ready access to, wouldn't it be?
Well, it's the team on the ground, and they go back through the interactions that we had, including those through Healthline, through the providers that might have been providing face-to-face support, and through the clinical teams, and seeing what support they were providing as well.
The Wellington Mayor has notified that there's been a positive wastewater test here in Wellington. Do you have any more detail about that?
We had a positive wastewater test, I think, a couple of days ago. I think we reported it yesterday at Moa Point, and it was congruent with some positive cases that were in the managed isolation facility here.
Yeah. Just on the schools, can a school choose if it is best for their community to have the students back full-time in that younger age group?
We want schools to be managing this in a way that's safe, so they'll need to adhere to public health guidance. They'll be sent out quite comprehensive public health guidance that's been shared with them over the last few weeks as we've been consulting them on how best to do this. Now, bear in mind that some schools have got a lot of empty space, for example, and the ability to spread students out more. Other schools are really jammed in, and so it won't be 100% even across schools. So we've set out exactly what they need to try and achieve, and we give them some flexibility to be able to do that.
I'll let you Can I just get clarification on that, please? Could a school choose to have students back full-time if they thought they could meet the public health requirements?
If they can adhere to the public health requirements while they're doing that.
Can you give me an idea just of roughly how many schools will be there full-time, how many will be part-time, and how many might stay closed altogether?
No, I can't give you that guidance. Schools will be working with their local schools. I don't know at this point. Schools will be working with their local communities. They'll be given pretty comprehensive advice. They've already been given quite a bit of it. We'll certainly know before it happens, but at this point, we need to allow schools their time to work their way through that.
Rob Jackson has previously warned that there could be a super spreader event at schools. Children currently can't be vaccinated, or most children. Is this a responsibility?
Well, I'll let Dr. Bloomfield comment on the public health advice that we've received, which is that actually schools are a relatively safe environment if all of the public health measures that we're putting in place are put in place.
That's the advice that I've had from my team, and also in discussion with counterparts in New South Wales who've got quite a lot of experience over the last month or two with this, that they're not seeing that spread within primary schools, even amongst unvaccinated children. And as the Minister said early on, the spread's more likely to happen outside of school settings than inside.
So what happens if an unvaccinated teacher turns up to school, if a completely unvaccinated teacher turns up to school next Tuesday and refuses to leave? What happens to them?
That's ultimately a matter that the schools will be working with the Ministry of Education to manage. The Ministry of Education have been in very close contact with schools over the last week or two to make sure that they're preparing, to make sure that they know exactly where they sit with their staff, and they've been getting regular feedback about that. There are a handful of schools who are reporting that they've got some concerns, and the Ministry is working very closely with them.
Teachers be arrested, for example?
Look, I wouldn't go that far at this point. I mean, ultimately, I don't make decisions about who to be arrested. Those are matters for the police. But schools will work closely with the Ministry of Education.
In terms of the King Country schools that have reported staff not wanting to get vaccinated when it's a small school, a large amount of the staff, or will they not open next Tuesday?
The Ministry of Education will be working very closely with them. The first thing that we do when we experience a pocket of the workforce that don't want to be vaccinated is to make sure that we're taking an educate and inform approach first before we do anything else. We found with our port workers There was a lot of concern when we introduced the requirement around vaccination amongst our port workers that would result in a lot of port workers walking off the job. They didn't, and that was because we took an educate and inform approach. And many of them had been the subject of misinformation. In fact, they had been targeted by those who were spreading misinformation. And when we got good, reliable information in front of them, they made an informed decision and they chose to be vaccinated. And I'm confident that that will be the case with the education workforce as well. But we're having to pull out all the stops, of course, to make sure we're getting that information to them. You know, I'm aware that the people out there who are sowing disinformation are targeting these workforces in particular for that disinformation at the moment.
On the 9s and 10s, why not wait until years 11 to 13 go on study leave so you've got fewer students at school? Wouldn't that be a better risk balance?
But we do want to see these students back at school. Ultimately, as I said, we've got an 80+% vaccination rate amongst our secondary school age population. I don't have the regional breakdowns, but Auckland is doing very well in that age cohort, and as a result, the risk there is lower because of that higher rate of vaccination.
90% is your target for everything else, so why is 80% good enough for this age
Well,
group?
it's not for workplaces. So workplaces are open right now with often large groups of people in them, providing they're following public health measures. So this brings secondary schools into line with large workplaces effectively.
Can I ask Dr. Bloomfield?
I'll tell you what, we'll come over here to Ben.
Bloomfield, just on the 3 deaths in home isolation, looking back on the previous 2 days, had a few days, is the health system failing these people? Should they have been in hospital? And obviously we're not quite up to investigations in the third person yet, but what broadly can you say about how home isolation is working for people with COVID?
Well, the first thing is I can say it's working well. There are at the moment in Auckland 1,671 people isolating at home. We are continuing to strengthen and improve the system, and in particular the clinical assessment and advice of anyone who's isolating at home. I should say there are still 344 people in isolation in quarantine facilities too, so there are people who, for health reasons or because they can't isolate safely, are in quarantine, and there is space to have them there as well, so it's not that there's a shortage of space. We're looking back at each of these deaths, obviously, to see what was the level of interaction, exactly what happened in those cases. Was there any problem with the clinical assessment and also the clinical handover? There's nothing to suggest so yet, and obviously the third one, which just came in overnight, we don't have detail on, but we look very carefully at any opportunity to improve both the initial assessment and allocation of someone, and also how the system is working. We are, of course, using pulse oximeters where people we think may need to be monitoring, be monitored, because some people can deteriorate quite quickly, even if they have a history of being well and are well at the time.
We'll head over to this side of the room.
They don't die if they're in hospital, do they?
Yes, people do die. In fact, till recently, all our deaths had been in hospital.
Our experience with COVID is they're much less likely to die if there's a ventilator handy or whatever.
Well, obviously, we've now got many, right through this outbreak, most of our people have been in the community, either in a quarantine facility, now at home. It's a relatively small proportion of people who have ended up in hospital. And yes, then if they do deteriorate, and of course their admission to hospital is based on a clinical assessment, if they do deteriorate, then oxygen and other measures can be taken. But likewise in the community, if people become unwell, they can be and are transported to hospital.
What kind of consultations have been had with Kurakaupapa Maori across Tāmaki, Makaurau, Waikato? And is it, considering how spread the outbreak is in Māori communities, is it just a bit irresponsible to even entertain opening up schools at any stage at the moment?
There's been good consultation across the education sector, and that includes our kura kaupapa and our kohanga reo. So the Ministry of Education have been working with all parts of the sector to prepare for schools reopening. There is a degree of nervousness out there. There's a degree of enthusiasm out there as well. There are a lot of mixed emotions amongst the education sector, and I think that's why we want to step through this carefully. We need to rebuild that trust and confidence amongst the parent community so that they are confident in sending their kids back to school, and that's exactly what we'll be doing over the next few weeks.
Dr. Bloomfield, just the 2 cases isolating in Kaikohe, there's been no locations of interest in Kaikohe. Why is that?
My understanding is because whilst there might be exposure events, they are ones where they know all the people who were at those events. So we only will notify locations of interest if they were a public place and where there was a possibility that members of the public who may not have known were exposed.
A little bit of stress in the area too, though. People are just a little bit scared. Kaipai's a tiny little community. And do you think that by not having that clear information out there like that, it's just leaving gaps for people to think, hey, COVID's a hoax, all the stuff that we're kind of seeing in the streets at the moment?
It shouldn't be, and just to reiterate, the locations of interest we put up very promptly if we establish that there may be risk or exposure to wider members of the public. Most of the exposure events that we get, for most cases, are in settings where we can identify and track down all the people there, and so there's no need to identify a location of interest.
So it's just on vaccine certificates. We're seeing Auckland open up its retail stores. A lot of places are wanting to only let in vaccinated customers. You spoke about it yesterday. Is there an update today on vaccine certificates?
We'll certainly have a pretty comprehensive update for you early next week about that. The system is in its final phase of trialling to make sure that everything's robust and that it's all going to work according to plan. I'm confident that we will have the system available to people and we can provide a bit more of a timeline on that next week. Jessica.
With Northland coming out due to come out of lockdown tomorrow, has anything changed for you and your thinking around that? Is that still set to happen?
Yes, that is still on track to happen. We haven't had at this point any reason to reconsider that.
Clarify with you, Dr. Bloomfield, about that second vaccine. So if you are unvaccinated at the moment, can you just choose which vaccine you have? Is that an option available to people?
Yeah, to reiterate, our program is, and for good reason, a Pfizer-based program, and that was a deliberate decision. And one of the things that it's nice to be able to look back in retrospect is that it's turned out to be one of the most effective and safest vaccines, so including against Delta. AstraZeneca is there as an option for people who can't have the Pfizer or people who are required to be vaccinated because they're captured under an order, not willing to have an mRNA vaccine like the Pfizer one is, and this gives them an alternative vaccine. And there will be a process around that, and we will outline more detail about that next week.
So one of the reasons that we want to work through that process and outline that next week is that we want to make sure that if people are saying that they would prefer to have AstraZeneca, that they're making an informed decision there, not based on misinformation about an mRNA vaccine. It was a very safe vaccine. So we will put in place a process that will make sure that if people are doing that, they're doing it in a way that is considered and informed, rather than one that's based on misinformation.
How widely available will people be able to get the AstraZeneca vaccine at as many places as they know to get Pfizer?
No, it will be available in a limited number of places, but there will be geographic spread of that. Joe.
Is it
70 odd staff, I think it is, in mobile vaccination clinics can't go from Auckland up into Northland this week. It's very much been driven by the Maori health providers. What work are the DHBs specifically doing, both in Northland, Tairāwhiti, Lakes, those areas where the rates are low? Are they driving some of this work, or is it very much being left to the Maori health providers to do it?
It's very much a joint effort in all those rohi, and we've seen, I think, some really good results in Tairāwhiti, Northland, and Taranaki, I would add, over the last week or two. Of course, it's those Māori health providers who are delivering the services out on the ground, and they're doing a fantastic job, but very much with support, including funding support, but other support from the District Health Board. So it's very much a joint effort in all three of those rohi.
We saw with Tairāwhiti the situation where there wasn't a mobile vaccination clinic. So have more resources gone into that area given the very low rates there?
They have, and some of that, of course, was the additional funding, the additional $60 million that was provided for Māori health providers, and with a focus on, I think, 7 DHB areas to start with, and some of that funding was to support the use of mobile vaccination clinics.
Mark.
Joe,
one more, and then Mark, and then Henry.
In terms of the Trans-Tasman bubble, it's obviously up for review again at the end of this month. Are you giving any serious consideration to doing anything about that, opening to some states, whatever, or are you leaving it in the next year?
Look, we haven't actually made decisions on that at this point. Of course, we keep it under constant review, as we said that we would do. And we are entering a new phase in terms of our international border management, but that is, of course, intricately linked with the work that we're doing around our domestic boundary and around our overall work here. We want to see as high a rate of vaccination as possible before we see the presentation of more potential COVID-19 cases in the community. And so all of those things get considered all of the time. I think we are getting into a point where things are going to look very different, within the next 3 to 4 months, in terms of the international border, in terms of trans-Tasman travel, in terms of travel throughout New Zealand, in terms of the way we manage cases in the community. Everything is changing, and it is changing quite rapidly, and it all interconnects. There's a relationship between all of it.
Can you see the point from, I guess, people who have family in Queensland, for example, where there isn't COVID and hasn't been for some time, saying, in 3 to 4 months' time things will have changed significantly? Are you not giving any sort of serious active consideration to states that are in that situation?
I think I outlined a few weeks ago, we looked at some of those lower risk Australian states, and one of the challenges there is that they are in the process of progressively removing their own restrictions. And so the risk profile there is changing as well. So, of course, we keep it under review, though.
On vaccinated travel, which is exactly what we're planning to do. So how is that any different to our opening up strategy?
Well, they haven't done it yet, and like I said, we keep it under review. I'm not ruling things out at this point, though. Mark.
Sir, on ventilation in schools, you said that the summer will give a good chance to sort that out. What did you mean by that? Just that it's easier to open the windows?
Look, by far the best ventilation is to have the doors and the windows open. And if you look at the design of most of our schools, that is the main source of ventilation for those classrooms. They don't have air conditioning systems. They don't have those kind of built-in air conditioning systems. It is the doors and the windows. And so summer makes that a lot easier. And actually that's very effective when they have all their doors and windows open. It is actually, it creates a good flow through of air.
Well, you're looking forward, next year there will be COVID in the community, hopefully not in high numbers, but it'll be there. And we get into winter, what's the strategy for schools then, I guess is the question.
Look, our goal here is to move forward and to keep moving forward. So not to move to something that we then have to flip-flop backwards and forwards from. So the response framework, the protection framework that the Prime Minister set out just recently, the traffic light framework, whatever you want to call it, is really designed on making sure that we don't have to keep going backwards, so that we can manage risk. Where risk escalates, we can kind of turn the dial on the risk down without having to impose a whole lot of unnecessary restrictions.
If a teacher comes to you next week, or comes to their board next week and says, look, I will get the AstraZeneca vaccine at some point, but they're refusing to get the vaccine now, will they lose their job, or is that a holding pattern that they can put themselves into?
Well, that's something to work through. We do have an exemptions process in place, and the Ministry of Education can provide more guidance on that. But one of the things about exemption is we have to be clear on the grounds for an exemption between now and the end of the year. So if you've got people who are saying, look, I'm never going to be vaccinated, then there's not a lot of point in giving them an exemption. On the other hand, if there's a reason around timing or whatever, then that might be something that gets taken into consideration.
Can your reason just be good enough to just be, I don't trust the mRNA vaccines and I want to wait for the AstraZeneca one? Is that a good enough reason, even though I'm sure both of you agree?
Look, it's not a good enough reason for me, but we also want to make sure that we don't lose great people. I think the best thing is for them to have a conversation with someone who knows what they're talking about. And as I've indicated before, I actually think that where people do that, generally speaking, some of their hesitancy around the Pfizer vaccine disappears, and often they're willing to then be vaccinated with Pfizer. There is I just can't overstate this really. The extent to which some people have been subjected to information about mRNA vaccines that's just not true. People have been.
Were you worried about today making this announcement? Were you worried about that giving credence to that view? That by allowing some people to not have this vaccine, that you're giving credence to the mRNA vaccines are unsafe, when actually the AstraZeneca vaccine is slightly more dangerous?
I can sense the Director General really wants to comment on that, so I'll let him do that. But before he does that, I do want to be clear that the process that we'll have in place around that will be about informed consent. So people will need to actually know what they're signing up for and what they're not signing up for if they're going to make that decision.
Just to add to that, all vaccines have advantages and disadvantages, benefits and risks. We know that the effectiveness and safety profile of the Pfizer vaccine is very good. AstraZeneca is not as effective against the Delta variant, we know that as well, and it has some specific rare side effects that have been well publicised. We want to make sure that anyone deciding to have the AstraZeneca vaccine has access to that information, just as we have provided it for access to the Pfizer vaccine.
All right, there's one more from you, Henry, and then I'm going to come back over here. We are going to run out of time soon, so...
Do people outside of Auckland need to realise that COVID has got to be in their communities at some point in the next couple of months?
Look, I do think that there are pockets of the New Zealand community who have formed the view that COVID's not going to affect them, and they're wrong. COVID-19 is not going to remain contained in Auckland, and I've said that, I think, as explicitly as I can for some weeks now. We are reaching the point where COVID-19 will spread, and it will find unvaccinated people. That's been the international experience of that. But no, we are not going to keep Auckland locked down. As the Prime Minister's indicated, we actually want Aucklanders to be able to travel for their summer holidays. And so that does just reiterate the urgency for people around the rest of the country around getting vaccinated, because COVID is coming. I'll come here.
Thank you. Just for Dr. Bloomfield, so I appreciate you might not be able to talk about the latest home isolation deaths, but the previous two, are you able to say if they were being managed by a GP or a nurse and whether they had access to their medical records?
I don't have that specific information, but what I would say is that most of the daily contact, once a person's had that initial assessment, if they're isolating at home, is from Healthline, and that contact includes access to a clinician at any point in time who can join the call to delve further and provide clinical advice. As we shift the model, it is likely to be that general practices in some areas, some general practices are not set up with, they don't have the capacity or capability to support, but in some areas that general practices or practice nurses may be involved in some of that assessment and ongoing follow-up as well.
What are calling them if they got sort of clinical backgrounds?
They either have a clinical background or they're able to access a nurse or a doctor to be involved in the consultation. And this is just like, Healthline, which has operated here for more than a decade. People call in with an undifferentiated sort of set of symptoms, and they use a range of very good, clear protocols to determine whether or not that person needs further clinical advice and where the best advice is to come from.
Gina.
Why have you only got 344 cases in quarantine when there's 880 rooms available for them? There's 1,600 people isolating at home. You've got people isolating in cars and garages. That seems
Can I just note, in some cases, people indicating they prefer to isolate in the community and they are reluctant to go and isolate in an MIQ facility. And so, I can't comment on every one of those 1,600 people, but some people are making that choice for themselves. We are reaching the point, and we're actually at the point, we're well past the point now, where we can't put all of our cases into MIQ. And so default isolation in the community is the default, unless there's a good reason to put someone in an MIQ facility.
Most people prefer to isolate at home, actually. And one of the key questions that is asked is, are you comfortable and happy to isolate at home? And if people feel that they're not, then the opportunity is there for them to go into quarantine facility.
Also, looking at the numbers here, you've the contact tracing numbers, 1,142 contacts by these numbers haven't had a single phone call from contact tracers. How is that good enough?
I just have to go and have a look at the numbers. And
you're managing 4,500 cases in the community.
Yeah. So the main reason for that would be that the cases have only just been notified, and they are still identifying. They've only recently identified their contacts, and so those people are in the process of being followed up, and that initial conversation had with them.
Confident in your contact tracing system?
I'm very confident in our contact tracing system, and it's served us incredibly well right through this outbreak and indeed right through the pandemic.
Bloomfield, how's the working together process going with whānau ora at the moment? Has there been any progress?
Well, I haven't had an update to the contrary. I know there was a meeting yesterday, and my sense is that progress has been made to make the data available to really help focus efforts to identify Māori who haven't been vaccinated or who are late for their second vaccination. But we can provide an update after this exactly on what's happening.
Māori have made up the highest case numbers, represented highest case numbers for the last 35 days. What's being done to target Māori communities furthermore? Because obviously what's there just probably isn't enough.
Well, significant efforts going into both testing and vaccination, and very often we're for example, there might be a number of cases from a residential facility, either a transitional housing or other facility, then the teams are going back regularly with testing and vaccination offer, because often people are moving in and out of these facilities, and so that's one of the things that's happening. And of course, as you know, our Māori providers have had additional resources to help ensure they've got everything they need to support higher rates of Māori vaccination in particular.
All right, we're going to have to wrap up shortly, but I'll take a couple more questions.
A breakdown, more up-to-date breakdown of where people are catching COVID now, and what's their home contact to people who may be rule breaking. And also, Dr. Bloomfield, on fluoridation, what's your plan? The decisions are now in your hands. Is that a relief for you? And what's your long-term plan for that?
I'll let you have both of those if you like.
Thank you, Minister. I'll have to come back with you on the breakdowns around the settings where cases, it seems cases are most likely to have been infected, in particular the breakdown of household and non-household exposures. I'm very, very pleased to see this decision around fluoridation, and I'm looking forward to working with my team who've been developing a process about how I can assess, well, it's not me, it's how the teams assess and provide advice to me, and I sign off on fluoridation for communities across the Rohi. This will have a major impact, not just on child oral health, but on inequities in child oral health.
Is it going to be broken down? It won't be just a whole countrywide approach?
It won't be a whole countrywide approach because it requires a consideration of local and community factors. I can't just do a blanket approval, and I don't think that would be appropriate.
Last question.
Just on schools. So parents in Auckland and the Waikato have previously been told that wearing masks on their children, if they're under 12, is not appropriate because it would do more harm than good. Given the younger the child, the less likely they're going to wear it correctly. Why has that position changed now when we're dealing with the more transmissible variant of COVID-19?
Well, one of the things I would say about masks, as people will know, is our advice has changed, not just on masks, but on a range of topics as we've gathered more evidence and more experience. I think also one of the big differences is we are seeing much wider use of masks, much wider acceptability of the use of masks, and much more experience, even with children. I'm seeing children wearing masks. Our view was it was a useful additional measure that will help reduce the risk on top of other measures, so it's worthwhile doing.
All right, thanks very much everyone. We'll wrap up there.